Hey everybody, it's Willa with Step One HR Consulting. And like many of you today, I am sitting at home. My hair is shoved into this ball cap because I cannot get into my salon. And my kitchen table is covered in art supplies and Chromebooks and all this fun homeschooling stuff. So me, small business owner, entrepreneur, working out of my house just like everybody else and adjusting in these pretty uncertain times. But there's a couple things I am certain about that we're going to be talking about today. I'm very certain that in the coming days, small business employers are going to be required to adhere to a new law that has been signed into law effective March 18th. This new act is the Families First Coronavirus Response Act. And so this act has a temporary effective period. Employers are going to be required to adhere to this starting April 1st, which again is just in a couple of days. This particular law sunsets on December 31st of 2020. So today's video is me sharing some extremely high level details on this law. The one thing I want to share with you before I get started here is if you're an employer, a private employer with less than 500 people, especially those of you who have less than 50 people, you're going to hear things in this video that you might have never heard before. Acronyms and terms and regulations that you have not been mandated to adhere to before. And so I cannot stress enough that likely if you're that small of a business, you probably do not have an attorney on staff. You do not have an accountant on staff. You do not have an HR person on staff. And if you do, this is still new news and information. So build your network of at least a legal professional, a financial professional or accountant, and an HR professional. Whether you choose to use Step One and myself or not, these three professional folks in your network are critical during this particular time. I'm going to cover some very heavy, complex information with you today, and there's just no way to anticipate all of the different gray areas that could come along with how you have to make decisions as an employer on what you're going to do as it relates to these requirements. You're in a very difficult position. You are working on your business continuity plan and you're trying to figure out how do your people fit into this. Difficult emotional decisions. And so I'm not an attorney, I'm not an accountant, but I am an HR professional. And so my mission at Step One during this time is to help employers, especially small business employers who do not have HR on site, is to help you determine how to navigate the gray and how to do this in a way with all good faith effort and to stay compliant in what your requirements are. So I'm going to dig right into this. Again, the Families First Coronavirus Response Act was signed into law on March 18th. Its effective period is temporary from April 1st, 2020 to December 31st of 2020. There are two benefits for employees. But let's talk a minute about if you're an employer, do you qualify for being required to offer these two new benefits? So employers that are private and that have less than 500 employees are required to adhere to this law. If you are offering remote work for your people, they're still considered on staff working and earning their salary or hourly pay. And so this would not be in effect for those working remotely unless they qualified for the qualifying conditions, which we're going to talk about here in a little bit. So again, if you're an employer, a private employer that employs less than 500 employees, these are W-2 individuals, you are required, effective April 1st, to adhere to what we're going to cover today. So there are 6 qualifying conditions that would make an employee eligible for the paid sick leave benefit. Okay, that's the first benefit we're going to talk about as part of this law. It's paid sick leave. Now, there have been some states that have been working on and initiating paid time off for sick leave for employers. But of this capacity, this is really the first time the Department of Labor has forced such a large scope for the entire United States to offer this particular benefit if you're an employer with less than 500 people. So it's big news and it's new. So again, complicated. Find you a partner to help you initiate and integrate this into your business. So paid sick leave. There's 6 qualifying conditions, but there are 2 different pay options, and that's where it gets complex. When I said it was complicated, I wasn't joking. So we're going to cover those in detail. So an employee could qualify for paid sick leave under 6 conditions. 1, the employee is subject to governmental quarantine or isolation related to COVID-19. In this particular one, I told you earlier, there's some things that the Department of Labor are still considering, haven't put out a lot of solid information yet. This one's one of those, is what all qualifies as government isolation. We have some states coming out with essential jobs, essential industries, and non-essential jobs in non-essential industries. So there's still some gray in this that I'm waiting from my resources and my credible network of people to help me determine. So I do have some clients that I've had to share, listen, we're still working on this. So this is one of the gray areas. The second qualifying reason is if an employee has been advised by their healthcare provider to self-quarantine due to COVID concerns. This does not have to mean COVID symptoms. So I'll give you an example of a qualifying factor here. My mother is a breast cancer survivor. She went into remission in December of last year. And so at any point, her healthcare provider could say, listen, you, because of this pre-existing condition, should not be working as a cashier, which is what she actually does for a living. And so high exposure, if her healthcare provider said that, that qualifies as number 2 here. Doesn't have to do anything with actually exhibiting symptoms. So this is important to understand. The third qualifying reason is the employee is experiencing symptoms of COVID-19 and actually seeking a medical diagnosis. And so the first 3 reasons I just covered, the calculation for pay is a little bit different because those are personally impacting to the employee as an individual. So reasons 1, 2, and 3 are more individual impacting. So this is how the paid sick leave pays out. If you have somebody approach you for one of those 3 qualifying conditions, it pays out 2 weeks, up to 80 hours at the employee's regular rate of pay. But there are caps on these, and the caps are very important, and they become very important when we start talking about tax credit. So again, for reasons 1, 2, and 3, government says so, healthcare provider says so, or you've got somebody seeking a diagnosis for COVID-19 because they have the symptoms. You are required to offer them the paid sick leave at up to 2 weeks, 80 hours of pay calculated at their regular rate of pay. The cap on this is $511 a day, and the total cap is $5,110. Okay, so that's qualifying reasons 1 through 3. They're individual to the employee. Qualifying reasons 4, 5, and 6. Those pay out differently, and that's why I'm having this discussion a little bit separately. So qualifying reason number 4 is the employee is caring for an individual subject to governmental quarantine or isolation, or a healthcare provider has made the recommendation. So number 4, this is more about the employee caring for someone else. Now, caring for an individual, The Department of Labor has come back and said this does not have to be family. This is important. This is a recent change. I told you this was a moving target, and it is. They added this. It does not have to be a family member. So keep that in mind as you have people approach you about this. Qualifying reason number 5, the employee is caring for an eligible son or daughter under age 18 if their school or place of care has been closed due to COVID precautions. That one's pretty cut and dry. There's going to be lots of documentation out there on, is the school closed? Is the daycare closed? Are there odd hours that are being offered, etc. Qualifying reason number 6 is also gray. I've got a large network and I'm still not comfortable, in full transparency with what does this mean. It feels like a catch-all. I'm being told it's a catch-all. But I'm looking for more details on what that means so that I can, like I said, what my mission is, continue to keep you updated and on the right track with being compliant. But number 6 reads, the employee is experiencing any other substantial similar condition as specified by the Secretary of Health or Human Services in consultation with Secretaries of Treasury and Labor. Pretty gray. So I'm going to be honest with you, still working on that one. But if you have somebody approach you with qualifying reasons 4, 5, or 6, number 4, they're caring for an individual subject to governmental or health care quarantine recommendations, does not have to be a family member. Number 5, the employee is caring for their son or daughter whose school or place of care has been closed. Number 6, pretty much any other substantial similar condition. Okay, still working on that. But here's how this one pays out. Because as you can tell, the first 3 qualifying reasons were part of the employee's individual circumstances and health. The reasons 4, 5, and 6 have to do with someone else in the employee's network, be it friends, family, etc. So this one pays out differently. The payout is 2 weeks of pay up to 80 hours, calculated at 2/3 the employee's regular rate of pay. So not full pay, but 2/3 their regular rate of pay. The cap on this is $200 a day and $2,000 total. Okay, so it's a lot to digest. When I told you a lot, and you're going to need legal, financial, and HR help, now hopefully you understand that part. It's a lot. To add to what I'm sharing, and to make it more complex, there's a second benefit that the Families First Coronavirus Response Act offers to its employees, or offers to employees. This one has a couple different criteria. First of all, the employee has to be employed at least 30 days to qualify for this benefit. The benefit is paid expanded family and medical leave. I said earlier that those of you with 500 or fewer employees are required to adhere to this. But those of you with 50 or less employees, you probably very rarely, if have ever, heard of FMLA. And so this expanded family and medical leave is brand new news. And so even those of you who have less than 50 employees are required to adhere. And so employees who have been with you for at least 30 days qualify for this additional benefit. But there's only one qualifying factor here, and that is that the employee is caring for an eligible son or daughter under the age of 18 if the school or place of care is closed due to COVID concerns. So you're like, Willa, what's the difference between paid sick leave and option number 5 that I shared, or this expanded family medical leave? The only difference is these people have been with you for longer than 30 days. And so they're offered additional time. That's pretty much the cut and dry of it. So let's talk a little bit about how this pays out. And you'll have to listen carefully on this one. So employers are required to offer 10 weeks of paid expanded family and medical leave time. But there is a 10-day waiting period before you actually get paid. Okay, so it's actually 12 weeks. The first 2 weeks of that is unpaid. The following 10 weeks is paid. Now let's talk about that unpaid 2 weeks. If your company has an existing PTO policy and let's say an employee has 30 hours in their PTO bucket, they can opt to use it and be paid, but you cannot force them to use their existing PTO. That is a part of the regulations of this law. You cannot force them to use their existing PTO. They can choose to take it unpaid. They can choose to use the paid sick leave that we just discussed for reason number 5. So in most cases, I cannot imagine an employee opting to not take it paid and use the paid sick leave benefit that we just discussed. But who knows? I've seen weirder. But more than likely, they're going to opt to use that. But you cannot force them to use their PTO balance as per your company's existing PTO policy. That's a very important piece of information. So they can use their PTO balance for the first 10 days unpaid. They can use the new sick leave up to 80 hours paid for the unpaid time. The 10 weeks that you're required to offer them for paid leave is calculated no less than 2/3 of the employee's regular rate of pay for their regularly scheduled amount of hours. Now I've got clients who are struggling with this. They've got employees who are paid by the hour, but maybe they're paid by the project. And so they're not necessarily always 40 hours a week. They're paid by the project. So it might be 20 hours this week and 50 hours next week. These are the areas of complexity that you need to have people in your network, legal, financial, HR, that are going to be able to help you navigate these so that you can make good faith effort to do the right thing and document. So again, I want to repeat this benefit. If you have employees that have been with you at least 30 days, they are eligible if they have a son or daughter under the age of 18 whose school or care facility has been closed due to COVID. They are eligible for 2 weeks of unpaid leave where they can use the sick paid leave new benefit to be paid for that, or they can use their existing PTO. And then you're required to offer them additional 10 weeks at 2/3 of their regular salary based on an average, their regular average number of hours worked per week. The cap on this, the cap is $200 per day and $10,000 in total. Another couple things, the tax credit, like I said earlier, I'm not an accountant, but you're going to need one as you continue to navigate this year and kind of going into documentation and preparation for this. But I am going to share a couple things as it relates to this topic. Employers who are required to adhere to this law qualify for dollar reimbursement of tax credit for all qualifying wages under this law. Qualifying wages are those paid to employees who take leave under the Act up to the appropriate per diem or aggregate payment caps. I do know for a fact that I've had clients who have asked me, can we do more, right? They want to be a little bit more generous than what the required amounts are. The answer is you can certainly do that, but your tax credit is only going to accept anything up to the caps that they've actually put in place. So the caps are important as it relates to that. We talked earlier about possible exemptions for employers. I want to cover those. From a legal perspective, I would recommend highly visiting with an attorney before you submit to the Department of Labor request for exemption, just to make sure that you're following the right path. But I'm going to share with you what has publicly been shared as potential exemptions that you can pursue if you're an employer, a private employer with under 500 people. These are some possible exemptions. So number one, the provision of paid sick leave or expanded family medical leave would result in the employer's expenses and financial obligations exceeding available business revenues and cause small business to cease operating at a minimal capacity. The second one is the absence of the employee or employees requesting paid sick leave or expanded family medical leave entail a substantial risk of the financial, health, or operational capabilities of the employer because of their specialized skills and knowledge of business and responsibility. So this is really tied probably to more technical roles and industries. Possible exemption number 3, there are not sufficient workers who are able, willing, or qualified, or who are available at the time and place needed to perform the labor or services provided by the employee or employees requesting the paid sick leave or expanded medical leave. And this labor and services are needed for small businesses to operate even at a minimal capacity. So again, highly recommend visiting with an attorney partner or someone in your network before you pursue this, but you can certainly pursue exemptions through the Department of Labor website. There's information on how to do that. So I want to close with just reiterating how new and how complex this is. Certainly HR Step 1 and myself and my team are here to support you in any capacity that you choose. It's a lot to read, it's a lot to go over. There is a lot of public information. So certainly if you're trying to pinch pennies, and a lot of us are doing that in this time, you can find a lot of this information out there. I'm a bit more concerned because it's one thing to have it written on paper. It's another thing for me to verbally sit here and go over it with you, but we're not living your day to day. We're not having difficult conversations with your employees. You are. And so I want to offer our services to support and help you during this time. For the months of April, May, and June, Step 1 HR is offering 50% discount on our My Human Resource membership service. This is a monthly membership fee where you can contact us directly at any given time for one monthly fee. And so you can learn more about that at our website at step1hr.com. You can call me at 479-644-9395. Email me at Willa, W-I-L-L-A, at step1hr.com. But I wish you the absolute best. This is the first of probably several videos you're going to see from our team on how to continue to support you in our mission of making sure that you're compliant and your employment brand stays very healthy. So wish you the best of luck. Give us a call, look us up, and wish you the best.